Right, so to the Congressman's point, could this be dead on arrival? And then what's the fallout, if indeed it is? Diana Furchtgott-Roth, a former Reagan economic advisor. We got Mark Serrano joining us, a former Bush 41 campaign advisor, and Marjorie Clifton, Democratic strategist. Marjorie, is this thing dead?
Is the bill? Well, I think as he pointed out very aptly, this is not necessarily a policy issue, it's a politics issue. And I think right now, look, every policy there is on the table, be it health care, tax reform, all of these can be good things for both parties. These are things that, we can always better legislation like Dodd-Frank. I think the question and the divide is happening a lot around what we replace these issues with, and frankly, what's happening at the top in terms of Trump's leadership. Because I think Republicans have found themselves in more of a rapid response mode, having to move very quickly on policy that they hadn't quite gamed out. They didn't have, what exactly the replace would be. And I think that is what is coming to fruition, is sort of this mad dash to figure out what do we put together and how do we align, because alignment is very, very important.
Well, they're not aligned. To your point, they're not aligned. No. So, Diana, the question then becomes, whatever people think of this health care rework, rewrite, whatever, it is almost certainly going to delay these tax cuts. It would seem to me, I could be missing something, but it doesn't look like that timetable is as Treasury Secretary Mnuchin was telling me just last week, an August event. I don't know.
Well, first of all, I think this is a very good health care reform proposal, and it reduces costs by expanding flexible savings accounts and health savings accounts.
We don't know that. It hasn't been scored yet, but that is the hope. You're right.
Well, in the legislation, it takes off those limits for flexible spending accounts, and it expands the amount that can go in health savings accounts. And we need to figure out how we are going to provide health insurance for people who cannot afford it. And having a tax credit for that, allowing them to choose their own insurance plans, is the best mechanism to do that. The alternative is an expansion of Medicaid, which means that you basically deliver to people the health care that you want them to have, rather than the health care that they can choose. So I think this is a great plan. My only criticism of it is that it starts too late in 2020. It would be great if it could start earlier in 2018 or 2019. And that the freeze on new Medicaid enrollees would not be left to 2020, but would take place at the end of the year or the beginning of 2018. But this helps bring market forces into the provision of health care. Just like we have a debit card for people who don't have enough food. They take the debit card, they go buy the groceries. We don't deliver groceries to their door. This gives basically a debit card for the purchase of health insurance.
A lot of things, to your point, have to fall into place. But already, Mark, one of the things I'm seeing is there are concerned conservatives within the Republican Party, but also some moderates, like Rob Portman of Ohio, Lisa Murkowski of Alaska, who worried. I think they were among 3 or 4 Republicans who sent a letter to Mitch McConnell, worried about the Medicaid overhaul part of this, that this would this would come back to bite the party on how open it is to protecting people and providing insurance. What do you say?
Well, look, Neil, if last night, after the new package was announced by Paul Ryan, if Rand Paul and Mark Meadows and Dave Brat had said, we love this bill, it's perfect, let's go with it, we'd be shocked, I tell you, and we'd expect for it to move through. Look, this is going to play right into Donald Trump's hands perfectly.
How so?
Because the Democrats have rendered themselves irrelevant, because they're going to resist every policy.
I think Republicans have rendered themselves irrelevant.
No, they really haven't. They've given us plenty of space for negotiation. If you take a look at it.
Did you just hear some of these other guys? They're miles apart.
Look, but they haven't even, Donald Trump hasn't even gotten started yet. He's going to bring these guys into the room, and they will talk.
I don't know what he believes in, though. What is he supporting?
He believes in cutting deals. I'm telling you, Rand Paul will have a seat at Donald Trump's table. Mark Meadows and Dave Brat, these guys will have a chance to make their case to say, look, there's not enough free market in here. Even Donald Trump even tweeted today, said, look, we're going to bring down these barriers across 50 different markets.
But he's the same president who also talked about bringing down drug prices. That's not a free market appeal. That could be interfering with the capitalist process, right?
Right, but he's coming at it from all different angles.
People to choose their own plans and with the credit.
Marjorie, let me answer this, because we're always told that the Republicans, from the Democrats' perspective, are going to screw this up, but obviously this law is imploding of its own weight and lack of affordability, and premiums that go up, and higher and higher deductibles, where people this is intended to help oftentimes refuse medical care. So it has to be fixed. Republicans, Democrats, ideally together, but I'm wondering, are Democrats then going to say that this is Republicans' fault? In other words, this cost problem is going to be Republicans' fault.
Well, I think the cost problem has already been evident, and part of that happened because a lot of people were opting out that we never thought would happen. People were willing to pay the fines. Employers were keeping insurance that we didn't think to. So, you know, again, market forces that were, frankly, leading to unintended consequences. So I don't think overhauling is something, or even revising slightly, is something Democrats are adverse to. Now, Neil, what you're asking is politics going to be politics as it's been politics? Because, of course, Republicans blame Democrats for all of the market outcomes that happened with the last bill. Will Democrats do the same thing to Republicans?
They already are.
I hate to say probably so.
Yeah, but this is a crisis we're in the middle of. We're in the middle of a crisis. We have to fix a crisis. I mean, this was a problem that became a crisis. The Republicans now own it. They have to fix it, and they will. They'll negotiate a terrific deal that will bring costs down with free market principles.
All right,
that's what's been missing for 6 years.
That sounds,
there's a lot of free market principles in
magical.
this bill.
All right.
However,
we don't know. We don't know. Guys, I don't know. It looks crazy right now, but we'll see. Maybe Ken sort out here.